make sure my audio's working. Just turn up a little bit there, Vic, just to see. Yeah, if I do go live, we'll just do a quick test to see. I'm just coming on really because I've heard today that I think it's News of the World that I've actually broken it. That there's a new drug coming out, and heard about this last year. I did actually break it to that. I was told that there's a new drug that's going to change the dynamics of bronchiectasis and how it's treated, and it was called Willow. I don't know if that's still the same name of this tablet that they're bringing out that you take one a day. That's supposed to reduce a lot of your infections, so I'm guessing it's some kind of mucus thinner, but it's probably the best mucus thinner out there. So I got told it was called Willow, spelled Willow, Willow, like a willow tree. And I got told it would be coming out next year, which would be this time. And I fell upon a bronchiectasis group today that I shared the link, and I said, here we go. These were the clinical trials that they were talking to me about in Wivenshaw Hospital, that my specialist said there's something coming, and when it does come, we'll be willing to trial you with it. Will you take it? Will you take it? And I will take it with open arms, because even though I have the long-term IV meropenem and the tobramycin long-term daily, still things are a struggle. Sometimes with the tobramycin I might miss a dose, I might miss a day, and that's just because of day-to-day struggles. For example, I've had a port incision, and for the first 2 days I was really struggling to do anything, let alone take my medication. So it's great to know that there's a tablet out there that we could fall back on, that sometimes when we have bad days with mental health or physical health, that we know that we're just not riding or surviving on antibiotics or steroids like we have in the past. There's actually something out there. So I'll show you the guy in question. I'll show you this article first. This one came in the Daily Mail, not the World. And I'm just making sure it's actually sharing the screen, yeah? You can actually see this article on the what I've got up here. You can't see it? Right, give me a second. I've not shared my screen, that's why. I'll come back to that in a minute when I share the screen, because I've not shared the screen. So when I share the screen now, you should see me and a screen like this. Can you see that? Yeah, you can see me. So this is the guy in question. He's called James Charles. And why I have zoomed in on this guy is because dating back a while ago, if you remember, we had a bit of a petition going, so to speak, where we wrote a template letter and we sent these letters out to everybody. We sent them out to all the places I knew had chest clinics, lots in Manchester, lots throughout the country, and we never got a response. I actually sent a letter to James Chalmers, which is the co-funder, we can call him the co-funder of bronchiectasis trials, the guy who tests things, the guy who gets the funding and the resources to pump back into bronchiectasis. Well, I sent this guy a letter and hope he read it. He seems like a good guy. I mean, look at the medication I'm on. Tobramycin inhaled medication, and it probably had something to do with this guy. In fact, maybe he said that, this guy really needs this medication. Anyway, so to speak, he's done some trials that could be life changing in many aspects. I'll let you have a quick read of this. World first clinical trial raises hope for new drug for chronic lung disease. A drug which reduces the risk of the people living with a chronic lung disease from needing antibiotics or emergency hospital treatment could soon be a reality, according to the results of a clinical trial. So I heard about this last year when I first started my tobramycin. I heard. So we can have a quick read here. A drug which reduces the risk of people living with a chronic lung condition needing antibiotics or emergency hospital treatment soon could be a reality, according to the results of a clinical trial. The results from the phase 2 Willow studies were announced today by James Chalmers, British Lung Foundation Professor of Respiratory Research at University of Dundee at a virtual meeting of the American Thoracic Society. Sorry about this, guys. That's what happens when you share your screen. Broadcast around the world. Scientists at university, in collaboration with global biopharmaceutical company, I don't know what that word is, incorporated tested. This is the name here. I'm going to highlight. This is the name of the drug because I've seen this on the I forgot the name. Did say the News of the World Daily Mail broadcast it. That's the drug we're talking about. And I'm trying to think how it's said. Brensocatib. Anyway, this is the drug that they're talking about in patients living with non-cystic fibrosis bronchiectasis, a long-term lung condition which causes abnormal widening of airways. The final results demonstrated the patients on the brensocatib could be potentially reduce the risk of pulmonary exacerbations by more than 1/3 compared to placebo. So I'm trying to think what they mean compared to placebo. Does that mean compared to people who don't have this trial or have not trialled it? A further clinical trial, also led by the University School of Medicine, is currently exploring whether brensocatib. I've got to really learn how to say that because that is a tongue twister. Brensocatib can be used to prevent the need for mechanical ventilation in COVID-19 cases. So let me highlight that there. So we did a further clinical trial. I didn't actually get this given to me in hospital, but it seems that they've been giving this medication out during the pandemic, really. So that's quite useful. Bronchiectasis causes a buildup of excess mucus that can make the lungs more vulnerable to infections. Complications associated with the disease, known as pulmonary exacerbations, often require frequent medical treatment. Treatment for bronchiectasis is currently limited to controlling chest infection symptoms using antibiotics. So this seems like this is, what's the word for it? An eye-opener. The drug will need to go under further rounds of clinical trials and receive regulator approval before it can be routinely prescribed by doctors. So again, that says by doctors, so I'm guessing that maybe specialists can prescribe this if you sign a consent form saying you're willing to go under trial. But the scientists have hailed these results as evidence that drugs can potentially be used to treat bronchitis directly. So maybe we're finding a drug that it won't stop the chronic condition, but it will slow down the progression. And this is what I said about this condition a long time. They need to slow the progression down, not wait till it gets out of hand. Living with bronchitis means that you're constantly at risk of needing emergency treatment when the condition worsens, said Professor Chalmers. That's what we could say before. I'm sure he's a professor, so it's not just James Chalmers, it's Professor James Chalmers. We currently rely on antibiotics to treat chest infections caused by bronchitis, with a few options to stop the disease from getting worse in the first place. We are excited by the possibilities of a drug which can break the vicious cycle of inflammation, lung damage, and infection for these patients, giving them a much better quality of life. And what did I write in these letters? If I can dig these letters out, guys, I will dig these letters out. I was saying I'm sick and tired of the quality of life that we have. Not the neglect on purpose, but not people not having the knowledge how to treat this condition, whether it's your GP or when you go to A&E. So I think he's looked into that letter, guys, that we did that template. So we might not have got a direct, response, but reading stuff like that suggests that, we've hit the nail on the head somewhere and we're finally getting somewhere. So I'm just making sure I'm back well. Yeah. I've read that the lung damage and the infections of these patients giving them a much better quality of life. This trial is a world first in treating an incurable lung condition that affects millions of people worldwide, and it's getting worse. It's getting worse as well because of the pollution, the air pollution, everything else. there's more people getting diagnosed each year. I think last time I looked, there was 3.3 million with the condition in the UK, which it was alarming, and that was last year. People with bronchiectasis have frequent pulmonary exacerbations, which are normally treated with a short course of antibiotics, normally 2-week courses. In most serious cases, hospital treatment is required. As we all know, it was never a never-ending battle with me. I had, I think, total spent 95 days in hospital over a 2-year period. Now I'm at home. I've got nurses that administrate IVs. Otherwise, I would be in hospital. I have the tobramycin inhaled antibiotics. Otherwise, I'd be in hospital. So maybe the level of care now is getting taken more seriously. We cannot leave these people with bronchiectasis under the umbrella of rubbish, if you know what I mean. It needs to be up there with cystic fibrosis, and maybe we're getting somewhere now. Symptoms include chronic cough, excessive sputum production, shortness of breath, and repeated chest infections, which can worsen the underlying condition. The disorder affects more than 200,000 people in the UK and accounts for more than 1,500 deaths in this country annually. I'm not having it's just 200,000 people in the UK with bronchiectasis, because it might be. I don't have the file to hand. I might be miles out with 3.3 million in a population of, 58 million, 62 million. I might be wrong. It might be 200,000. But again, I've not got the research to hand, so maybe it is 200,000. The last time this was updated. So I can't say it. Think how you pronounce that. Brensocatib. Brensocatib in an oral inhibitor of dipeptidyled peptidase, an enzyme responsible for activating neutrophil serine protease (NSPs) in the most common type of white blood cells. The cells play an essential role in the pathogen destruction and inflammation meditation. Meditation? What's that? That's not a mediation. I don't know how to pronounce that. But in chronic inflammation lung disease, they accumulate in the airways and result in lung destruction and inflammation. The team behind the study believed the brensocatib may decrease the damage effects of inflammatory disease such as bronchiectasis by DPPI1 and its activation of NSPs. Now, I was reading somewhere down the line that DDP1, it's a bit like where the body attacks it. I wouldn't say attacks itself like where it attacks the liver, but in many ways it is a cirrhosis of the lungs. So in a way, it could be the way the lungs are attacking itself, and it's an not autoimmune disease, but with that DDP1 and then SPS, it's something to do with the way it attacks the body. We were thrilled to share positive final results from phase 2 of the study of brensocatib, at the American Thoracic Society virtual meeting, said Martina Flemel, Chief Medical Officer. These findings are very meaningful for patients with bronchiectasis who suffer from severe outcomes in the absence of an approved therapy. Importantly, new data presented today demonstrates the relationship between neutrophil isolate, the LST reduction, and the risk of exacerbations, and serve a further proof of concept of potential of the brensocatib and its unique mechanism of action. We look forward to initiating our phase 3 program in bronchiectasis in the second half of this year, while also exploring the potential of brensocatib in the other neutrophil-driven inflammatory conditions. So, judging by this, they could be using this in cystic fibrosis. They could be even doing it in people with liver cirrhosis and other things where the organs get damaged over time, get damaged, and they have to take antibiotics to stop the infections. They could use this drug, so it could be a life-changing drug, not just bronchiectasis. I'm not going to read all this out. If you want to read it, go to dundee.ac.uk and you should find it on there. But that's amazing. So that dropped today. He's the professor, and well, that didn't drop today. That's been on his website for a long time now, because I remember reading about it. This is the article that the Daily Mail dropped today. Without all these stupid ads, we might get somewhere, but this is what they dropped today. Lung disease sufferers with severe breathing problems could be offered first ever treatment for the condition thanks to a daily pill. Now, if you look at the James Chalmers Dundee page, it said 200,000. If we read here, it says which affects about 400 Britons. So who's right, who's wrong? If that's the case, then the research suggests it's doubled in a year, which is very, very alarming. And it is the same drug there, which is on the James Chalmers website, highlighted there. So we've not got our wires crossed, it is the same drug. Sufferers of the lung disease that cause severe breathing problems and disability had to be offered the first ever treatment for their conditions in a trial. Bronchiectasis leads to phlegm building up in the airways, leaving patients bedbound with repeated chest infections. There is no cure, and over time, it can damage the lungs to such an extent that the splits from in the tissue causing bleeding. Ultimately, patients can suffer from respiratory failure and even death. So there's a picture of the lungs. I'm not going to read all that. Until now, the only treatment for the condition, which affects about 400,000 Britons, has been breathing exercise and repeat course of antibiotics, but a new daily pill called brensocatib may offer real hope. So again, going back to the letter, I stated everything was outdated. A flutter, we didn't have any breathing, anything that would help us rattle our chest, like in America, where they've got the what they call the vest that sort of vibrate the chest, so the mucus can come out easier. All we have in the UK is a flutter and a nebulizer and some breathing exercises. On top of that, we have inhalers, mucus thinners, which is carbamazepine, and Naxis. So it was almost like baseline treatments, especially for people that weren't getting taken serious, like myself 2 years ago. It's only now I've hit a baseline. So Professor James Chalmers, who holds a chair in respiratory research at Dundee University and is leading the brensocatib trial, I need to type that in one of them applications where it says the word brensocatib. I think that's the way. Said current treatments place a huge burden on patients, and this is what I was saying, not just a huge burden on the patients, a huge burden on the NHS, a huge burden on families that are involved. It's a wide spectrum of burdens we're talking about here, with many spending several hours a day performing exercise and inhale antibiotics. If the new drug is approved, it would make a major landmark in treatment. Let me tell you this guy's not lying when he talks about the amount of times we have to do things to make ourselves better. Inhaled stuff, exercise, coughing. It's actually a job keeping yourself kind of well with this condition, because if you start slipping on this treatment, that treatment, your inhaled treatment, you might as well forget about it. You're back at square one very, very quickly. So it's hats off to every bronchiectasis patient and cystic fibrosis patient out there doing their treatment, because I tell you what, it ain't easy. My nebulized treatment is quite a vigorous one. It's my Ventolin followed by saline, and then followed by the tobramycin inhaled, which wipes me out. Let me tell you, that absolutely wipes me out. When I have that drug, tobramycin, it takes me half an hour to feel like I've got the benefits of the drug. Bronchiectasis is inflammatory condition that permanently widens the airways and causes the body to produce excess mucus, a sticky substance used to trap pathogens. As a result, bacteria-filled mucus gathers in the lungs, leaving patients prone to chest infections. Let me state, they have to take serious as well. They're only talking about chest infections, but they don't talk about nasal infections. And I think we have to, when we talk about bronchiectasis, we have to think about upper and lower respiratory infections, because I used to be on the mouthpiece when I took my antibiotics, but I requested that, can I use a mask? And since I used a mask, the nasal infections have come to a baseline. To counter this treatment, immune cells called neutrophils rush to the lungs. Also, that's how it works. Okay, but rather than engulfing the bacteria as they normally would, the neutrophils react to chemical signals released by the bacteria and explode. That's amazing. So, at least with this article, we're learning how this tablet works. It further congests the lungs, making it harder for the body to clear the infection. In previous trials, brensocatib was found to halve the number of chest infection patients suffer. Results of the new trial of 1,600 patients are expected next year, and this is the face. This is the face that's going to bring this medicine home. I told you, kicking, screaming, banging bronchiectasis. I think that even though we got no response, these are direct response we're looking at now. We went to the British Lung Foundation. We wrote to every chest hospital that I could possibly send, at the time, and obviously Professor James Chalmers. I nearly called him James Charles. He's somewhere else. So, in previous trials, I read that right. So, it's a new drug called dipeptidyl peptidase DPP1 inhibitor. Normally, the enzymes DPP1 signals to the immune system to destroy the bacteria, but with bronchiectasis, patients release too many compounds, and it is this excessive response that eventually damages the lungs. So I think they're just talking about we create too much mucus here, and that's what they're talking about, really. By blocking the production of DPP1, the new drug enables the body immune system to function normally, hopefully, and I think that's it on the article. So this new drug, I don't think will be offered to everybody. I think it'll only be offered to a select few. But those who get offered it and who are in a similar position to me, I strongly recommend you take it and see how you get on. Because if nobody takes these trials, then where's the evidence to say it works? It might work somewhere in America, because I know this drug has been trialled in America, but it's people like us that should be taking it, and that way it could be landing in a chemist near you. So keep fighting, keep screaming, keep banging bronchiectasis.